طيب بسم الله الرحمن الرحيم. We're going to talk about the red flags in spine. To start with, as an introduction, what is a red flag? In general, in medicine, a red flag meaning that if the patient has one of the red flags, it doesn't mean that you have to do an emergency thing to the patient, but you have to be very careful dealing with that patient. You have to do more investigation. You have to do close follow-up. You have to make sure that you're not missing a major problem for the patient. And you can do that by, as we mentioned, doing more investigation and having close follow-up to the patient to avoid any sequences of missing a significant pathology. So we have general red flags in all patients with different complaints, which is age. Children might have more commonly to have, if they complain, they're more prone to infections and tumors, and also patient above 50 years old. If a patient has fever, weight loss, history of cancer or family history of cancer, night pain or night sweats or chills or fevers, if the patient has a trauma, especially a significant trauma, patient on steroids, they have low immunity, they have weak bones, so they might have significant pathology, and patient with IV drug use, they're more prone to significant infection. And we have specific red flags for spine. Again, if the patient has trauma, especially significant high-speed trauma, if the patient has any bowel and bladder disturbance, meaning bowel incontinence, fecal incontinence, or urinary retention, loss of power and sensation in the upper or lower limb, especially complete sensation. If the patient has gait disturbance, meaning they lost their balance or they are too weak to walk suddenly, all these are red flags that might indicate a significant pathology that needs urgent intervention to prevent further damage to the limb or life. Most of our red flags in spine might indicate some significant pathology, such as the CAUDA EQUINA syndrome, which is a severe neurological injury, most likely caused by disc herniation. Patient will present perianal numbness, decreased rectal tone, loss of movement in the lower extremity, or weakness in the lower extremity. If the patient has, let's say, a history of cancer, so this patient might have a metastatic tumor to the spine that will cause a pathological fracture, meaning a fracture to the diseased bone, without trauma or maybe minimal trauma. Again, infection will do the same. And also we have the true traumatic spine fracture, which will cause, again, might cause a neurological injury to the spinal cord or the CAUDA EQUINA. Just remember that spine fracture can occur without trauma in patient, as we mentioned, having pathological bone, as like metastatic tumors, or osteoporosis. Patient with severe osteoporosis and weak bone might have a significant fracture without having a trauma. لما نتكلم على التروما, we mean significant trauma, we mean high speed trauma, as we mentioned, اللي هو motor vehicle accident, with falls, with sports, all these considered high speed trauma and need to be, the spine need to be cleared before allowing patient to mobilize We might have, as we mentioned, low energy trauma in high-risk patient with known to have spinal canal stenosis. عندهم severe مثلا arthritis وفي عندهم severe stenosis. ممكن with minimal trauma they might have spinal cord injury. Patient with some conditions that affect the joints like ankylosing spondylitis, osteoporosis, or metastatic tumor to the vertebral bodies. طبعا traumas غير الهاي energy اللي هي penetrating trauma like a knife and a gunshot wound might cause an injury to the bone and the spinal cord. Again, we stress on neurological examination, thorough neurological examination by assessing the muscle power and the sensation. Sensation should be for light touch, sharp, dull, vibration, proprioception, and two-point discrimination, and to assess for reflexes. The reflexes more important if the patient have hyperreflexia. Hyperreflexia might indicate spinal cord compression, not traumatic spinal cord injury. طبعا احنا نتكلم على الكمبريشن على spinal cord. عندنا two major categories. اول واحد اللي هو traumatic spinal cord injury. هذا يحصل مع الحوادث، مع الفراكشر dislocation، مع severe disturbance of the spinal column. وفي عندنا النوع الثاني من spinal cord injury، هذا اللي يحصل بسبب الديجنريشن. يعني ممكن واحد عنده مثلا arthritis في السباين وبالتدريج يصير عنده compression على السباينال كورد، وهذه الحالة تسمى myelopathy. myelopathy معناته compression على spinal cord non traumatic، يعني ما يكون عنده تروما ولكن عنده progressive مثلا upper motor neuron lesion، وبنتكلم فيها ان شاء الله في spine degeneration، بنتكلم عنها بالتفصيل على موضوع الميلوباثي and spinal cord compression اللي هو non traumatic spinal cord compression. زي ما قلنا هذه ذكرناها قبل في التروما اللي ممكن المريض يكون عنده spinal cord compression، وهذه برضو تكلمنا عليها اللي هو الكومبليت ولا incomplete. هذا again all in a trauma patient. We have to assess the patient and determine if the patient has complete or incomplete. بعضهم يكون عنده complete fracture, complete spinal cord injury except for sacral sensation. إذا كان عندك sacral sensation is present, يعني كل شيء below level of injury is lost except for the sacral sensation. This is considered incomplete spinal cord injury. وش يهمنا طيب إذا كان incomplete ولا complete؟ يهمنا إنه في incomplete spinal cord injury recovery is better. We try to do more effort to decompress the spinal cord، لأنه في عنده higher chance of recovery. غير لما يجيك واحد مريض عنده complete spinal cord injury وانت ما يعني even if you do the surgery most likely patient will have none or minimal recovery. نتكلم على السنترال كورد syndrome اللي هو one of the type of incomplete spinal cord injury. طبعا هذا يجي في الالدرلي patient اللي يكون عندهم already عندهم severe arthritis في السباين وعندهم spinal stenosis في ضغط الحبل الشوكي ولكنه it's not severe. يحصل عندهم minimal injury especially في cervical spine اللي يسمون extension injury في extension injury في السباين، ويحصل عندهم central cord syndrome زي ما قلنا incomplete spinal cord injury characterized by زي ما قلنا يكون elderly patient already having stenosis and arthritis in the cervical spine, minimal extension injury, then they will have this يسمونه hyperextension injury ويصير عندهم upper limb more affected than the lower limb and have reasonably good prognosis. Anterior cord syndrome, it's one of the incomplete spinal cord injury. You don't need to know it. Branchycard, we spoke about it. It is hemitransection. It usually happens with sharp injury like gunshot wound or knife injury. بيصير فيه قطع على نص الكورد، تيجي الانجري على نص الكورد او جزء من الكورد، والجزء الاخر يكون intact. وهذا يعني has good prognosis and good recovery، لانه the other side سبحان الله the other side non-injured side will compensate for the injured side. نيجي على lower or below the cord level, below the L1 disc L1 L2 disc، وممكن إذا حصل عندنا injury either زي ما قلنا بفراكشر or a tumor or infection or with a disc herniation، يحصل عندنا something called CAUDA EQUINA syndrome اللي هو يكون عندهم saddle anesthesia and loss of sensation around the anal area and the genitals and decreased sensation. يصير عندهم urinary retention, not urinary incontinence, urinary retention and stool incontinence. ويوجولي زي ما قلنا يحصل مع النيرف روت، يحصل مع الديسكريميشن rather than with a fracture. زي ما ذكرنا سابقا عندنا انه النيرف روت compression او deficit. النيرف روت طبعا زي ما قلنا في كل ليفل في السباينال كورد او في السباين بشكل عام في left and right nerve root، وممكن يصير عليها compression، ولما يصير عندها الكمبريشن مثلا في اللمبر سباين يعطينا اللي we all know it is sciatica، عرق النسا، يصير في compression على nerve root، وهذا قد يكون most commonly يحصل مع disc ممكن يحصل مع fracture، فيصير في compression على a single nerve root ويصير pain و deficit along the distribution of that nerve root. ونجي لل other type of fracture which is the pathological fracture. هذه fractures طبعا تجي usually with minimal trauma or no trauma. طبعا الاوستيوبروتيك fracture is not by definition is not a pathological fracture، لانه يسموه insufficiency fracture، معناته انه في ضعف في الفرتبرا ولكن ما في disease باثولوجي واضح في الفرتبرا، هي بس ويك. فالاوستيوبروسيس ما يدخل تحت الباثولوجيكال فراكشر، يدخل تحت اللي نسميها insufficiency fracture، ولكن usually it is due to infection or tumor، بمعنى ان التيومر او metastatic malignancy goes to the vertebra and make it diseased and weak، والانفكشن كذلك. بعدين يحصل زي ما قلنا without trauma، ممكن المريض حتى ما يدري انه عنده تيومر، يكون the first presentation is back pain، then we do the images and we see a pathological fracture, then we can decide or diagnose the patient with the primary tumor. طبعا ممكن يكون primary tumor بعطيكم ان شاء الله في محاضرة التيومرز نتكلم عنها، ولكن primary tumors usually comes in children. أما في elderly patient if you have a pathology in the vertebra most likely it is a metastatic tumor، يا من البريست يا من الكولون يا من الريكتم ولا prostate ولا thyroid. It all might cause metastasis to the vertebra and might cause pathological fracture. ومن الساينز easy to see in the X-ray is the winking owl. I'll show it to you later. طبعا من العلامات في الهيستوري انه this patient might have a pathology in the vertebra. يعني لما يجيك مريض عنده back pain when you take history of back pain زي ما قلنا you remember red flags and you ask the patient about the red flags سواء سبيسيفيك للسباين ولا الجنرال ريد فلاجز. من الاشياء الباك بين اللي ممكن يكون ريد فلاج لما المريض يقول لك انا عندي الالم اكثر مع الرست، مع النوم، معناته انه في شيء قاعد يطبخ جوا الفرتبرا حتى وهو نايم. اما لما يجيك مريض يقول لك لا الالم يجيني اذا تحركت، اذا ركعت، اذا مشيت، هذا مور اوف ميكانيكال بين. اما المريض يقول لك لا البين ما يجيني الا وانا مثلا جالس، اذا جلست فتره، او وانا نايم يقومني من النوم احس في severe deep pain in my back. هذه كلها من الساينز، قد تكون من الساينز of a pathological lesion in the vertebra. طيب فهذه ممكن تكون infection او يكون tumor ويكون في البادي most likely. زي ما قلنا البرايمري سباينال تيومر هي برايمري، معناته انه التيومر نفسه هو جاي في الباك، جاي في الفيرتبرا في ذا باك، which is much less common than a metastatic tumor. طبعا البناين زي ما قلت لكم بتكلم عنها في محاضره للانكولوجي، ولكن بس تعرف انه ممكن يكون بناين ولا malignant، ويعني يجي اكثر more common to happen in children، يعني below 15 below 18 usually. في البون بشكل عام bone tumors، primary bone tumors most likely comes in children. في الالدرلي most of the bone tumors ومنها spine طبعا تكون metastatic. وزي ما قلنا ممكن يجي مريض عنده back pain and we find out that he has a pathological fracture in their spine. بعدين ندور على البرايمري تيومر، وين التيومر؟ يطلع مثل ما إذا عندها breast cancer that metastasized to the spine. وهذا very common actually to see it in my clinic, to see a patient never diagnosed with cancer. They come with a pathological fracture and we find out that they have other primary tumor. This is the winking owl اللي هو يعني بوم يغمز. بنشوف هنا البيديكل مختفي، هذا البيديكل الدائرة هذه شوف تحت نورمال، شوف البيديكل هذا نورمال يسميه بيديكل، عين هنا وعين هنا، هذا نورمال، هذه عين وعين نورمال. لما نجي هذه العين موجودة على اليسار، في اليمين غير موجودة، هذا معناته ايش؟ winking owl sign. زي ما تشوف البوم هنا عامل غمزة. طيب نجي للأوستيوبوروتيك vertebral fracture. very common, especially in ladies. They don't know that they have osteoporosis. They are not treated for osteoporosis. They come with porosis. Some consider it pathological fracture, but it is actually not. It is an insufficiency fracture rather than a pathological fracture. Usually comes with a wedging type anteriorly. Might be a burst, ولكن usually a compression كذا wedge على الانتيريور part of the vertebra. Often missed لأنه ما يكون في trauma. والpatient elderly patient complain of back pain. Some people won't take it يعني seriously. ولكن لو كان عندنا يعني if the osteoporosis is not treated, patient most likely will have multiple fractures ويصير عندهم تحدب، يصير عندهم kyphosis. And the treatment of choice is to treat the osteoporosis. So any patient that comes to you with an osteoporotic fracture, if you don't work up this osteoporosis and refer it to the endocrinologist to treat it, you did not treat this patient properly. Infections, most common is TB and brucella. Brucellosis اللي حمى ملطية. We see it with our community, and they having TB and they present again with same red flag, kind of sweats, so night pain, night chills, might have some also weight loss. We diagnose, we take a biopsy and take culture. And usually treatment of this usually does not require surgery, only medical treatment with anti-TB and antibiotics. نرجع للكودا إكوينا syndrome. It is once diagnosed, it's an emergency. Surgery has to be done within 24 hours to avoid permanent damage to the nerves. بمعنى إنه لو مريض خلينا عنده كودا إكوينا and patient was not treated and kept, patient عنده stool incontinence, urinary retention, weakness in the lower limb, ما يقدر يمشي, and patient was kept for more than 24 hours and surgery was not done for the patient might have permanent damage. يعني معناته حتى لو سويت له العملية بعد 3-4 أيام there is a high chance that the patient will not recover and will have weakness and bowel and bladder loss of control for the rest of their life. It has to be picked up. It has to have full examination, including a rectal examination for anal tone, because it will be lost in coda equina. MRI is mandatory to see which level is compressed and what's the pathology causing this compression, and to do emergency decompression, discectomy and laminectomy within 24 hours to ensure the best outcome for the patient. زي ما قلنا نشوف هنا في الصور هنا واضحة في right side of the view. You can see a huge disc herniation compressing on the spinal cord. This is a disc herniation على الكودا إكوينا عفوا, and causing this, and can be caused by disc herniation, most common, can be caused by a fracture as you can see here, and can be caused by say a tumor or an infection causing a compression on the caudal area. ممكن يكون هيماتوما as يعني تجمع دموي في المنطقة هذه, يمكن بعد ضربة, بعد epidural injection. There is a chance that they will have some hematoma as well that will cause the tumor. Another picture you can see here. This is looking at the patient from the side. Look at the left side. هذا الديسك الطبيعي زي ما تشوفون, وهذه الكودة الطبيعية ما عليها compression. لما نيجي المنطقة هذه راح جزء من الديسك طلع على الجهة الخلفية, ضغط كامل على الكودة. تشوفوا هنا في المنطقة هذه again this is the normal looking axial spine. هذا النقط السود هذه النيرفز, وحولهم الوايت اللي هو CSF. نيجي هنا المنطقة هذه you cannot see any nerves or CSF because large disc herniation compressing on that causing coda equina syndrome. Okay, any questions?
لا فيك يا دكتور, لا كويس.
طيب ناخذ another 5 minutes, then we'll come for the last lecture, which is a common pediatric spine problem. إذا عندكم أي أسئلة فكرتوا فيها عن المحاضرة الأولى أو الثانية, you can ask